YouTube. We're in the chair. Wow, isn't this different? Normally I'm on the other side. You'll see the crew behind me, Alfredo and Elliot, getting set up. They're going to come in with a series of different trays. We're going to size the tray to make sure we get the right size, because what we wouldn't want is too large of a tray, too small of a tray, and then when we get the final product we don't understand why it won't work or why it doesn't fit. So that will be part of the process as well. You'll see a lot of different materials, PVS material, alginate material. You'll see the digital camera come out. So it's going to be a lot of movement, a lot of activity over the next few minutes. This part of the process is the longest part, and it takes around 45 minutes start to finish. So when you do make that decision to say yes to Invisalign treatment, be patient and be prepared for about an hour appointment, you know, on that first visit, to make sure that all of the diagnostic workup has been done properly and accurately. You don't want to miss or cut any corners or have the clinical team rush, because in the end, once it's computer generated, something may be wrong, and that's what we want to avoid. Okay? Sizing of the trays.
Should be good. I'm using a large under the upper arch. Same as the bottom arch.
You always want to be relaxed during the impression process. Never tense up. Always keep and stay as relaxed as possible. And we'll say some things while the impression's in my mouth that'll help you think about relaxing those jaw muscles. There are different types of impression techniques. This is one that we have found works best for us. You may see impression guns, you may see an impression dispenser, you may see a two-in-one process. As long as it's a detailed impression material, it doesn't matter what the doctor's preference is.
So here we would usually say something like, okay, just relax, breathe through your nose, and Alfredo just went up, put a little pressure on that tray, and that's basically it. Simple as that. This usually takes about 2 to 2.5 minutes to set. In the meantime, we're just kind of talking to the patient, making sure they're okay, they're comfortable, and they're relaxed. There you go. You got a excellent, perfect impression. Let me get Dr. Dorsey a napkin.
And it can get a little messy from time to time. The guys are not as messy as I am, so that's good. I kind of come in with that disclaimer. The impression material doesn't have a taste. It doesn't feel like it's going to choke you. As long as you stay relaxed and kind of breathe in and out through your nose, you'll be fine. We are going to make one other set of impressions called alginate impressions. Those are also used for the diagnostic part of the treatment planning. So at night, when your doctor or your dentist is actually designing your case, they need something in their hands. So say I was doing this at 8 o'clock in the morning, I might not remember specifically what tooth I'm trying to move or how my bites comes together. So those are things that the alginate impressions, which we'll make after these, are very important. We'll also do what's called a bite registration, and that's to make sure that we know the indices of the teeth, the way the teeth actually come together. That's very important, because if we design the case to move the tooth and we don't know in which direction it was hitting, how can we know the proper position to put it in? It may seem unusual to have 2 team members in the room doing an Invisalign process, doing this process or the workup, but it's very common. Even if it were me on this side of the chair, I would still have one of my assistants, or maybe sometimes 2, in the room, because there's so many different dynamics that are going on at one time. The purpose of the impressions is to capture all of the anatomical features of the mouth, not just the teeth, but you need the what we call the roll or the inner cheek. All of that's very important to the designing of the trim.
Alright, so this one's probably the simplest of the three. Basically, I'm just going to instruct the patient to just open and close down as normal and natural as they can, usually on their back teeth. So go ahead and bite down for me, Doc. Excellent, and I'll look to see exactly how his bite is so that we can just replicate it with the putty in the mouth. So go ahead and open. And just bite down for me. Good, and I'll look to see if he's bit down, and he has. And we'll leave that set there for about a minute. There you go, I got an exact replica of his bite, okay?
Okay, now we're getting ready to make the alginate impressions. These will be used for the diagnostic workup that I will do later on tonight on the computer. The alginate material is mixed with water. It can sometimes have a flavor. Doesn't look like they gave me any flavor today, so it'll just be plain alginate. We hope that it's not soupy and that it's thick so it doesn't impress my throat, but we shall see. Good mix, good deal. So we're in good shape. There are a lot of impressions that happen on the first visit, so be prepared for that. A total of 4, sometimes 6 can be made in one appointment to get everything underway and captured. All right, here we go. The alginate impressions are diagnostic tools. So if something is devoid in the anatomical area, we can live with that, but we just want to make sure that we can articulate those together to make the proper movements of the teeth. So we'll make one more of those.
Back, relax. And then just lift up your tongue a little there. Perfect.
So the next phase that we'll do will be the photo shoot, and it's a lot of photos. You don't have to come like you're prepared for glamour shots, but we will take photos from different angles, and that's to make sure that we can see all of the jaw relations. Okay?